Hello, everyone. Thank you for tuning in today for this audiologic roundtable. I'm Dr. Heather Malyuk, Head of Audiology for Tuned. With me, I have Dr. Allison Hearn, Head of Provider Operations for Tuned. And with us, we have three of our esteemed audiologists who see members over the Tuned platform. We have Dr. Hannah Formella Zdroik, Dr. Juan Vasquez, and Dr. Patricia Johnson. The purpose of this roundtable is to compare and contrast clinical styles between tuned and in-person clinics. And we want to recognize that the listeners might not realize how vast and varied the field of audiology really is. There are many specialties, many ways to practice, and many ways that these different types of practicing complement each other. So today I'd like to focus on how Tuned is changing the game and providing access to more individuals than ever. So to start our discussion, I would like to know the biggest differences and similarities you're seeing between how you practice via teleaudiology with Tuned versus in-person clinical practice in the more traditional models. Would anyone like to kick us off?
I'll start. Again, I'm Dr. Patty Johnson, audiologist on the Tuned platform. And one of the biggest differences for me has been the ability to spend a little bit more time with each individual patient. When I'm in a typical clinical situation, we tend to be booked out weeks, if not months in advance. And the schedule is tight and there may be work. And so I have a short amount of time to spend with each patient. And of course, we practice on a really high level at that point where you're just very focused. But on the Tuned platform, I'm actually able to relax a little bit with the patient and get a full picture. I feel like it's more holistic hearing care. I'm able to look at that person and all of their screening results and all their health issues that they've reported to me, many of which have an impact on hearing. And able to really be kind of a primary care audiology provider. As you said, Heather, there are a lot of distinct areas of practice in audiology, and the value that I see in my work on Tuned is that I can provide more primary audiology care and looking at, does this person have balance and dizziness issues? Are they having a problem with ringing in their ears, tinnitus? Are they concerned about preventing hearing loss? Do they already have hearing loss? And kind of guide them on the right path and provide holistic care that more so, I think, than I would have in a typical clinical situation.
Absolutely. I'm in a unique position in that I review the reports every week and I get to hear feedback from our members. And that is something that has come up several times with people really feeling heard. That time is being taken with them. We had a specific comment actually about Hannah last week about her addressing all needs, that there was time for that. And she really listened and used all sides of her audiologic brain because she had time to. So I completely agree. Any other comments on that?
Yeah,
Hi.
and we can, oh, I'm sorry, Hannah, you go
No,
ahead.
go ahead.
I was going to say, even on a more practical level, we can meet this group of patients where their needs are not just giving our time clinically, but because, we take commuting out of the equation, we can, meet outside traditional work hours and really when everybody can focus on what's needed and meet their schedule as well, which is invaluable in my opinion.
On the similarities aspect, as far as telehealth audiology services and in-person clinical services, I think we can all agree that person-centered care is really at the center. And we really do value that as providers, that the person is in charge of their care and we can give them the education that they need and inform them of all the different options that they could go forward with. But I think similarly, in person and through teleaudiology, person-centered care is really important to all of us.
Yeah, I agree. Juan, did you want to add anything?
Yeah, I think just what all of us have been saying with how we can utilize this technology to help us conduct these services. And more than anything, as the heart of it, as Dr. Zdroik had said, it's the person is at the center of this encounter. And we really do take a fine comb and be as holistic as possible with addressing their primary concerns and their needs. It really is taking the hustle and bustle out of a traditional kind of clinical encounter and really just focusing at the question at hand, and we can provide some answers. And at the minimum, it's having a direct conversation with your hearing healthcare provider, and so nothing, no distractions generally, but it really just kind of eliminates a lot of barriers or limitations that in-person encounters generally have.
Yes, and I think one of the unique things too is our patient population is different than the individuals who tend to go into in-person clinics. So for those listening, as an example, we see a lot of people in their 20s, 30s, 40s, not your traditional audiologic patients. And because it's a benefit to them, one of the unique things, what I'm getting at, is we're seeing a lot of hearing conservation. People wanting to protect their hearing, they get to spend plenty of time with you learning about it, picking out earplugs or earmuffs, what works best for them. And to me, that's one of the biggest differences that I see versus when I've worked in more traditional clinics. You would rarely see someone walk in saying, I'd like to have a hearing screening and talk about how to protect myself. And yet what we're seeing on Tuned is that's 50% of the appointments, which is it's really amazing to me. And I know, of course, you're all seeing them. So to me, that's one of the biggest differences I've seen compared to the in-person clinical settings.
And
Go ahead.
It's very refreshing as a provider who's been fitting hearing aids for 20 years to be able to stretch those other parts of our education and our experience and have a group of people who are really interested in getting that care and thankful, and they can just ask questions and learn, and then they tell their colleagues about it, which just helps to spread the word about how great of a benefit Tuned is for employees.
Absolutely. And the fact that we're filling gaps that traditional care might not be able to fill. And I want to say, I'm going to give an example. But before I give the example, I want to say that in-person clinics, for those listening, are excellent. The audiologists are excellent. What they do is excellent. And sometimes they're bound by certain regulations within their clinic, certain products they're allowed to sell or not. So I just want to put that out there, that I think all audiologists who are practicing are great. And I think we complement each other. So the purpose of this story is to say we complemented another practice. We had a member come on to Tuned, get a hearing screening. He saw one of you, but I'm not sure which one. He was having issues with his hearing and seeking help. He was recommended an over-the-counter device that would help him. And he decided to go get a second opinion in person, which I think is cool. That's probably something I would do myself. So he went, had a test done, and was told that his hearing was not bad enough for amplification, despite the issues that he was discussing with the audiologist. The audiologist there, again, I think was probably wonderful, and I think she did a great job, but she was limited in terms of what she could provide. So he came back to Tuned and got his OTC and received help. And one of his comments was that we were able to fill that gap for him. So I wanted to bring this up because for those listening, they might not realize we're practicing in a very unique way, in that we've really expanded the tool belt for the audiologists on the platform. And we do try to give every option available. People can be referred for tinnitus care. They can be referred for vestibular care, all within our platform, over-the-counter hearing aids, hearing protection, prescription hearing aids, auditory processing difficulties, anything. So I don't know if you guys have any thoughts on that or comments, but to me, I look at our group as this giant group of audiologists that we're all working together to create a clinic that would be very difficult for someone to get to. And yet we're all working together.
I agree. And I think in piggybacking on filling in the gap, it's what I really love about Tuned is that it's become, I think, one of the only clinics that really has an emphasis on hearing loss prevention, on hearing wellness, talking about, what is my hearing like right now? I think what we're trying to do is to be that clinic, be the providers to help provide folks with clinical services to say, this is your hearing as it is. Here's how you can maintain it. Here's what to do to move forward to preserve what you have, and not necessarily waiting for a problem to happen. So there's an emphasis on the wellness aspect of it, to preserve that and to maintain that throughout your lifespan.
Absolutely. A comment that I saw recently that I loved was to one of our tinnitus providers, where this member wrote to her and said, "You've helped me find my inner peace again." And for people listening, tinnitus is mostly known as ringing in your ears or sounds in your ears, and it can be very debilitating and devastating. But being able to meet with an audiologist online at your convenience in the comfort of your home or office, wherever you are, and be able to achieve management of that is a very big deal. And so yes, I agree 100%. It's great to see these alternative, the non-typical hearing aid appointments and how people are being helped.
We even see a lot of people who are, working age and taking care of their elderly parents who are experiencing hearing loss and memory issues and balance issues for the first time. And they're concerned for their parent, and they're concerned about where their trajectory is going. So many of these appointments are, like Juan said, just hearing health conservation, whole hearing health, so that they can learn about what their personal risks may be with their family history and what they can do to prevent their hearing changes moving forward and keep their hearing health at the top priority.
Yeah, not to mention learn about what their loved ones are going through to be a better support to them, which is really big.
Yeah, I believe that everyone needs an audiologist, even people with normal hearing. And I think that's what Tuned really does, is approach that. And the biggest aspect is that Tuned can provide is education. I think that's so important, and it goes such a long way, because the more people know about their ears and how they work, the better off they are at making decisions for themselves, how things don't work if they understand how their ears do work. And it just provides like a bigger responsibility for themselves to take care of their ears and that holistic aspect. So I think Tuned really fills in that gap as far as like the education goes. They're more empowered to make decisions for themselves.
Yeah, it's that idea of whole head health. People take care of their eyes, their teeth. Why are the ears left to the side? And that's really what Tuned has been changing. I mean, we have over 100,000 members signed up to the platform now, and over 160 companies represented, and we're seeing it grow rapidly. I mean, that's just at this point in time. So there's definitely a hunger for that education, and people wanting to learn more about their auditory systems, for sure.
And I think Tuned overcomes some of the barriers to care, meaning access to hearing services, cost of hearing services. We're extremely cost effective, and the barrier to getting treatment, like some people, like you said, are not getting treatment for maybe a low-level auditory processing disorder that, yeah, they might have normal hearing thresholds, but we know from recent research that a lot of those people do well with really mild gain amplifiers, and we can do that, and we can provide a real solution that impacts their life. And that's a barrier in other places that it's not with Tuned.
Yeah, exactly. I mean, almost 60% of the counties in the United States don't have an audiologist. Yeah. And not to mention, I'm in Northeast Ohio, which is sort of a hotbed for audiology. And so if I have a patient in my in-person clinic that I run who needs care, tinnitus care, APD care, whatever, I try to help them find someone, that they have to go then drive an hour maybe to see. Where with Tuned, we give the referral, and it's follow this link and schedule and talk to this person. And no, you don't have to try and figure anything out or go through a scheduling center or call center or whatever. It's all contained right here. And I think there are many people who don't follow through with the care they need because sometimes it becomes such a web of trying to access something. And I have really enjoyed that aspect of how we practice, that we're almost like a, I don't know if network's the right word, almost like an audiology hospital system, you know, where we can just put in, you know, the referrals that are needed, which is so convenient for the members and beneficial. So to wrap up the discussion here, I'm curious if anyone has any final thoughts for us.
Something we haven't talked about is, yeah, we see a lot of younger people, but I've seen, people in their 50s, 60s, 70s who really are at the point where they need prescription amplification, like an over-the-counter kind of device is not probably going to work best for them. And those people that I see, I think, are far less resistant than people I've seen in a general ENT clinic setting. My experience has been then that people are coming really late to the game, and it's really a battle to get them talking about hearing aids. Whereas the people that I see on Tuned, a lot of them got a recommendation from people they work with who've seen us on Tuned and had a great experience and are hearing so much better. Maybe they got amplifiers or hearing aids through Tuned and they're doing so much better. And they're ready for care. They are ready. They want care. They understand that it's a good thing, that it doesn't make them old, that it makes them healthier going into as they age. So that's a big difference I've seen, and I think Tune fills that gap of giving people care who are ready because we've taken the barriers away.
Absolutely.
I think to add to that, honestly, just final thoughts, is that it doesn't matter if someone's ready for, if someone with hearing difficulties feels pressure to get hearing aids because their family said something, or if we're seeing a younger person who is working in a very loud environment and they want to keep and preserve their hearing for their lifetime. It doesn't matter what end of the spectrum or what part of life you're at. There is something for everybody. What's even greater is that it does take a lot of the stressors out of the equation. It's just upfront having a basic conversation, and this discussion, like what Patty was saying, is just to bring us to an understanding. And then when we're understanding from the client side, from the patient side, and the provider side, that's our intention, that's our goal. And it doesn't matter where you are, what phase you're at, there is a way to continue with hearing wellness.
Yeah, couldn't have said it better. You're spot on, Juan. And that's the goal of Tuned, is to bring hearing healthcare to the masses. So thank you all for joining today. Thank you for your time. And that's it. Thanks so much.
Thank you.
Thank you.
Thanks.
Thanks.